It is just a huge honor for me today to be podcast interviewing Dr. Bahar Esmaili DDS. She's the owner and dentist at PeakView Dentistry in Boulder, Colorado, where I got to see the Rolling Stones in 1980 when Keith Richards fell off the stage and Heart opened for her. That was so fun. She focuses on the connection between overall health and oral health. She's passionate about educating her patients about all areas of health. A healthy mouth can only exist in a healthy body. Nutrition, stress management, breathing correctly, posture improvement, and better quality of sleep can all affect the health and function of jaw, joint, and dentition. Her other passion is fitness. She's a certified trainer specializing in corrective exercise. She has seen a great deal of connection between overall gait, head neck posture, alignment of jaw joint, and tension and facial muscles and headaches, all of which affect the health and structure of teeth and supporting bone and gum. This has led her to focus her practice on comprehensive and detailed diagnosis of jaw joint issues, and she has a huge following on Facebook.com/PeakView Dentistry, and she's PeakView Dentistry on Instagram. Bahar, you knew you were going to be a dentist when you were born with the last name Esmaili. Did your dad?
I didn't. But believe it or not, I did not know that.
Is that right? when did you find out that your last name meant Esmaili in Boulder, Colorado?
That's true. That's true. It's just divine interventions, I have to say. And somehow you end and land where you meant to be, and you couldn't be happier. So happy that universe brought me here.
I hate to have this be the first question. It's so bad, but you're from Colorado, and in the next election, Arizona is voting on whether or not we should have legalized recreational marijuana, just like Colorado. And let's say, was it Oregon? Oregon and Colorado were first?
No, it was Seattle, I think.
Oh, it was Washington?
Washington.
Okay. So I like to talk to other healthcare providers, doctors. I mean, everybody knows the pros and cons of drinking alcohol, smoking pot, whatever. But the question is it treated better illegal, where if you're doing it, they kidnap you, arrest you, and put you in a cage, or not? And so what would you tell all the Arizona dentists, 6,000 Arizona dentists, who are going to be going to the polls voting on whether or not we should be just like Colorado to legalize it?
Marijuana. It's just that it's going to, in my opinion, it doesn't matter if it's legal or not. People are going to smoke it on their own volition. The only difference is now you're going to really ask about them on their history. So makes those cases when you want to sedate them, the interactions with meds easier. And also you get to know other signs and conditions that they're masking, so they're more open to talk about it. I have people freely telling me if they are using it recreationally, they're using it for meds, for pain management, versus it was a taboo that you won't talk and you want to ask, although you know. But legalizing, and I don't think that I want to really go forth and say whether or not it's therapeutically a benefit, whether we should be going for it or not. I'm not a medical doctor, won't speak on that. But definitely I'm on the side of CBD, which is not the same as marijuana. I think that has greatly changed a lot of inflammatory conditions in people. But for marijuana, if I were to say to those dentists whether they should vote on it or against it, I mean, the only thing is when something is legalized, it's easier to track it. That's all I've got to say. It's not going to change the consumption rate of it for that perspective. It's just going to make it a lot more manageable in terms of regulation.
Yeah, well said. Humans are humans, and I don't think there's ever been in the history of the world where just because something's illegal, the humans stopped doing it. It just meant that it drove it underground, and then it makes it harder to communicate, deal with, all that kind of stuff like that. My gosh, I was just surprised that a dentist from Denver, when you survey people about dentistry, the two big factors are cost and fear. They're afraid of the bill and they're afraid of the fill. So I thought when you guys legalized it up there, I thought within a week somebody saying, "Hey, come to my dental office and we'll give you a brownie to eat, and it'll get rid of all your fear and anxiety." I'm not
going to deny that it hasn't crossed my mind. I'm just totally kidding. But I think you're right. The fact of the matter is people use it. They tell you about it. young ones using it. It just made the conversation a lot more smooth as far as what kind of recreationals are you using? I need to know because I'm about to add 3 more to it.
Yeah, and I don't want to embarrass any old retired dentists out there, but when we were in UMKC, there was a dentist in Kansas City that me and Randy Kerwin went and visited, and he went by the name Dr. Ace. That wasn't even his name. It was just a cool marketing name. He was Dr. Ace. But when you walked in his office, he had a full wet bar. And he thought that was the driver because people are so nervous and scared to go to the dentist. And so when you walk into his deal, you can make yourself a drink. Now, I don't know what the legalities of that would be today. I wouldn't even want to try to have a full wet bar in my waiting room, but it shows that anxiety is very high. I wanted to get you on the show. You're doing so many things. But I always want to know when people start getting interested in TMJ or TMD or whatever, where does that come from? I mean, did you used to grind in Brooks, or did you have a kid that was a grinder? Where does the interest come from?
The thing is, though, the fact is TMJ is such a misnomer. It's as ludicrous as saying elbow, and people use it all the time. And the fact is, temporomandible disorder, it is a syndrome. And what really intrigued me about finding more about it, learning more about it, taking a million hours of C's about the TMJ is it is probably one of the most important joints in your body. And why people don't know it, because of the level of adaptation that joint goes through silently to a point that we almost see the footprints of this disease everywhere else in the body, in the mouth, in the head and neck, yet we don't know that the problem is right here because we don't see it. So it's overused joint. You have to, even if you're paralyzed, you got to eat, you got to talk. So every time you're doing those actions, you're putting this joint through use. And being a personal trainer, I know all about muscles. I know about synovial joints. So every synovial joint, including the TMJ, has liquid inside of it to separate the bones and make them movable. This is a different joint than all others because the end range of motion for this joint is not where the muscles are fatigued. It's where the teeth come together. And we know if the teeth are not lined up correctly, which now that has a whole school of thought of why, that's going to affect both sides. And the joint is not one, it's two, and it's articular space between the jaw and skull on two sides, and the third leg is the mouth. That's what makes it super complicated, and that kind of leads to a scheme of problems that now we're learning. And I'm glad to report we have found the actual cause of TMD disorders and airways and how they're connected, and we're digging into it to see what else could be affected. I mean, why are these people, and more so now, we're seeing young people affected by this because airway is a complete connection to TMJ and the function. So if you can breathe correctly, guess what? Your lower jaw needs to be positioned in your joint. And if your airway is a problem, kids are starting at a really young age, and I'm saying juveniles, 12-year-olds that are having problems, and it's a new tsunami of diseases of this generation, as I like to say it, that we're seeing. That's why I stopped practicing clinical dentistry and started really just focusing on what's really connecting dentistry, mouth, to the rest of the body. I actually want to write a book about this, and believe it or not, the title of the book is The Truth Be Told, Your Mouth Will Tell You the Story. So it's just amazing.
Nice. Well, cut to the very end of the book and just tell me the answer. Am I supposed to buy the brownies or the
brownies can help.
The brownies.
Yes.
Hey, I wanted to ask this because I thought it was a big takeaway. When I got my MBA at ASU, I graduated in dental school in 87, got my MBA in 98. They kept showing all these case studies where the engineers, they're all engineers, but it was someone over in the accounting department that actually saw something that didn't make sense. And then when she brought it to the engineers, they realized, wow, you're onto something. But it's usually another department that sees something. And it was the anthropologist and not the dentist. It wasn't the dentist. It was the anthropologist that says, we don't see all these malocclusions if we just go back 500 years to 1.5 million years. So my question is, isn't that a big clue that something's massively changed?
You hit the nail on the head, Howard, and I cannot agree with you more. I 150% agree with you. The fact is, the disease, we don't see the disease. We see the effect of the disease on the body. We see dysfunction that the body goes through in the absence of normal function. Now, we all are born complete and perfect. Now, genetic and evolutions, one can argue, is a part of it. But to me, that's just the loaded gun, and the lifestyle and environment is the trigger. So kids that are growing, for example, the babies that are born, if they're not breastfeeding, they're using bottles, pacifiers, and when they go through toddler ages, instead of eating hard food the way our bodies were designed to chew and develop, they are having soft food that melts in their mouth, tongue that is not trained to go to the palate where it was supposed to go, nasal pathways that are not being formed because tongue is not positioned at the roof of the mouth at the young age, environmental allergens that we are constantly exposed to, pets, humidifiers, like lack of real environments that our kids should be growing for their system to be strong. Instead, you're raised in environments that are full of allergens with this boosted immune system ready to attack something. So they capture everything in the environment and become allergic to it. So their nasal pathway from their soft tissues occluded, they're mostly mouth breathing instead of nasal breathing. And then when they're mouth breathing, tongue doesn't function the way it was supposed to. So their growth is halted at a young age. Tongue tightness is more common. We could attribute that, could once do a study and say that's attributed to the nutrition during gestation development. Why this many tongue tightness that we did not have before? Why is it that all these kids have speech problems and tongue isn't functioning? So this kid grows up with a tiny jaw, with no nasal pathway for breathing, in a dysfunctional system that's using mouth for eating and breathing. So as you're growing, now they need to find out the position for the head that's most optimal for them to continue to breathe. So their posture is also affected because of that. Their sleep patterns are affected because of that, because tongue is not sealed at the roof of the mouth. Nose is not doing what it was supposed to do. So their sleep patterns is completely disrupted, which is a whole set of issues that these kids are going through, basically not developing, and their bodies are being affected. Now, we've seen a lot of ADHD syndrome conditions, cognitive disorders, kids' ability to learn is being affected. Their crowded teeth and crooked teeth, which to me is the least of the concern. We can always give them straight teeth. I'd love to have white, straight teeth. But we're missing the big picture. American kids and Western diet is promoting more of or is causing smaller jaws, not bigger teeth. Our kids don't have bigger teeth, they have smaller jaws. And that small jaws leading to airway constrictions, is leading to posture issues, is leading to physiological changes in their pH, because mouth is the wrong avenue of breathing. And when your tongue is constantly out in your airway and in the way of doing the functions, then your brain has to get it out of the way, and it's conducing to clenching and grinding and TMJ issues. Like I said, it's just a snowball effect, which could be plugged and treated if you were to just get these kids into the right care and checking for what needs to happen and getting them the right food, giving them real bacteria, real viruses to be exposed to, so that they actually will have bodies that are strong and can defend themselves, versus raising them in environments that are lowering back in real environments that they need to develop immunity against, and vaccinating them. I'm not anti-vaccine people, but this is the reality. Our children not getting a chance to grow, and then they grow up and becoming this dysfunctional young adults, 18-year-olds. In my practice, Howard, I'm practicing in Boulder, Colorado, right across the street from University of Colorado. Hopefully at the end of this, I will get a chance to go around and show you the views of our practice. It's beautiful. But to the point of that, I'm getting a lot of these young people in my practice. And as you mentioned, that anthropologists who kind of put the dots together and said, that doesn't make sense. Almost on a weekly, daily basis, I'm getting someone in that 8 range, I call it a freshman syndrome, coming in. They have jaw issues, they have headaches, they have clicking, locked jaw, shoulder issues. Their teeth are pristine. We don't have cavities anymore in these children. They have straight teeth. They have all had ortho. But why are they on anti-anxiety meds, on ADHD medications? They already are falling apart. 20-year-olds are on CPAP. And I had to learn why, because I can't just stick a night guard in their mouth and call it good. By the way, night guard will make things worse with apnea and obstructed apnea. So 3 years ago, that journey began when I started practicing in Boulder, Colorado. And it led me to this point where I have practically learned every course that was offered, every CE that had the word TMJ and airway, and I learned from the best of the best. And this is what I'm hoping that I can get a message out to everyone is, airway is not a small subject. Snoring is not a static issue. And TMD is a real disorder connected to all of this. And every time that something breaks in the mouth, it's not because that was a soft food that happened. This is connected to a bigger problem. It's almost like looking at someone's shoe wardrobe and seeing that all their shoes are worn the same way. This is what I started noticing. All these kids, shoes worn the same way. It's not the quality of the shoe factory. It's the way they walk. And until we focus our attention towards preventing them and addressing that, we're constantly into the fix-it mode and they break and we fix them. They break and we fix them. And we fix them only at the tune of their symptoms. They come with symptoms. We throw at them the problem, the solution to get them out of pain, to fix that tooth, put a dentistry in there that doesn't break, and send them off to the universe. It's almost like diabetes. If you have diabetes and we cut a finger because it was infected, we didn't cure diabetes. We just cut that finger. And this disease is more multifactorial, more global, more systemic than we knew. And airway is the generational disease that I could anticipate, especially now with the COVID-19 and masks and people are wearing them, more mouth breathing than ever. And I'm seeing more decay problems from there and declining health coming from that. I think this is more than ever. If I want to promote and advocate nasal breathing, this would be the time, because our nose is the most natural pathway of air through our body that filters bacteria, sterilizes it, takes the right amount of air exchange between our body and air. So if you're not establishing a nasal pathway early enough, by the time they get to be 50 and 60 years old, we're completely in a state of dysfunction from this one tiny problem, the nasal mouth breathing, or lack of nasal breathing for that matter. So I'm hoping that I didn't answer a small question in a complicated way, but it's a nearly encompassing subject.
I could listen to you for 40 days and 40 nights. It reminds me when I went to Scotland, Michael Gow profoundly impacted me because he says, well, you know, when someone has anxiety and you just put them to sleep, you knock them out, you go do their dentist and wake up, but you didn't treat their anxiety. And he wanted to treat the anxiety, so he went into dental hypnosis, and he says it might take, you know, some 3 or 4 appointments beforehand, but I treat the anxiety with the hypnosis, and then they're dental patients. And we both know. I'm going to tell you, this is reality. When someone has any of those issues you talk about in the United States of America, 150,000 general dentists, 32 hours a week or more, 30,000 specialists, 32 hours a week or more, they say, oh, okay, have them come in here and do an FA, see if their insurance will cover a night guard. If it's yes, then the assistant will come in, take 2 Allergens, make a night guard, and then a week later they come back in. The assistant tries on, has a bite down twice. The dentist comes in, checks the little bite marks, and they're done. That's how TMJ is done 4 out of 5 places. So
isn't that scary?
But here now it gets worse. She just got out of school. She's 25. She only became a dentist because her mom is. That's how her mom does it. And her mom doesn't even know a word you just said. How would you coach a 25-year-old who just listened to what you said, and she's working with her mom? How do you get from, I'm 25, my mom's over here, Bahar's over here, and I mean, so what would you advise her?
It's so funny you said that, Howard, because 90% of my patients are in that age group, and I have their complete attention. And here's where I approach it. If I want to see, if the youngsters need to be able to see a global problem rather than having a tunnel vision of, I'm just a dentist. I'd like to think of teeth as the tip of the iceberg. Here's what the dentists need to do, especially right out of school. Matter of fact, my goal is to create a course for hygienists and young dentists to get them right out of school before they're getting into the nook of what the insurance will pay for, fix the problem as they're thrown at you. Step back, see the body, forget about the teeth. Matter of fact, don't look at the teeth. Look at the person in front of you. This person is attached to those teeth. Those teeth are like the children in the family. In a family that's dysfunctional, and I'd like to come up with an example. This I came up with out of dental school. You'd be amazed to hear it. Think of this as a family. The jaw joints being the father, teeth are the kids, and muscles are the mom. So this whole system has to completely work together, functional. How many functional families do we know these days? None, right? Here's why. Because if there's dysfunction between the jaws and the teeth, the muscle's going to have to compensate. Teeth get broken, muscles get overactivated. And all we see as dentists, we don't see the joints. At best, we touch them and say, oh, yeah, there's a clicking in there. Well, what are you going to do about it? Nothing, just record it. That's the norm. When we look at the teeth, oh, my gosh, there's worn dentitions. Get them a night guard. Stop right there. I would say to the youngsters, stop. Look at those signs and consider them as real evidence of a bigger potential problem. And when I'm saying potential, and I'm not saying every patient that grinds on have TMD disorder has apnea, but literature is supporting that 90% plus of folks that have forward head position, they have TMD disorders. It's an area of clicking, jaw joint noises, limitation in opening, difficulty chewing, and worn dentition. Majority of them have one form or another of either upper airway resistance syndrome, or they're suffering from full-blown apnea, obstructive or centric or worn. The teeth are only telling you the story, pretty much like those routed children in a dysfunctional family, that makes it known that this is not a functional system. There's something wrong, otherwise these kids would have been better. The same thing here. Teeth only will pay the dues of this dysfunction, and unfortunately, dentists only see the teeth. A really good mentor of mine recently, Dr. Hal Stewart, I'm actually planning to do a full residency with his institution. Brilliant guy. He came up with this example that just kind of stuck with me, and I want to quote him on that. Think of the young person as a front-loading washing machine that's functioning, and then the washing machine is turning. The first time that they need a dentistry, and he's putting it as simple as a sealant that goes in there and it's not in the right place. That it's almost like a stone or a brick that we throw into that washing machine when it's working. It starts rattling and it moves a little bit, but it still continues to function just like that kid would. So it doesn't break right away, but it will rattle, make a noise. As it turns, you throw another one in there, it will rattle more, and more of those screws will come undone, and then the washing machine will continue functioning. This continues on every crown, every dentistry, every night guard that was not legitimate, and it was not the right treatment that gets put into their mouth. Everything we put in people's mouth is another stone we're throwing into that system that was already dysfunctional. There comes a point where they're completely broken down. And at that point, we find them in a terminal dentition, and all we can do is pull their teeth and give them dentures and implants and all enforced, which is all great treatments. I'm glad we have them, but why wait until they're there? I'm seeing more 50-some-year-olds, 60-some-year-olds that needing to be repaired at that stage with those extreme ends, and they have lost what was already a God-given and could have been saved just because we're not being smarter version of ourselves, because we're single-minded into thinking teeth are just teeth and it's my area. I'm just a dentist. If I were to define one term, is dentists are not just dentists. We're physicians of the head and neck, and dentistry is getting more broader, bigger, more encompassing of the rest of the body. To make matters even worse, we're seeing the connection of nasal breathing and jaw position and TMD with activation of the diaphragm. I could probably talk about that one subject alone, how diaphragm activation in response to nasal breathing affects posture, low back issues, and just about everything. Because if a body is going through life with dysfunction and this 12-pound medicine ball or head is in a uncomfortable and a dysfunctional place, something will some brake hair will go off somewhere. We just don't know how quickly and where. But I can tell you that washing machine example I just gave, that will not continue to work until it will continue to work until it stops and it comes unglued, but not right away.
So you said the TMJ is the father, the teeth are the dysfunctional children, and the mandible is the mom?
No, the masseters and muscles, temporalis, masseters are the mother. Now, just I think I have a different analogy to come up with. It's like you said, the system has to work. There's a nervous system that controls all of this. And, your body knows one thing: survive and propel through life no matter what it costs. And we know that airway is on top of the list for the brain, because how many seconds do we last without oxygen in reality? So if anything is stopping that normal flow of air, brain has to jump in, brain has to do something, activate an afferent. Is that deferent? I kind of have to remember that part. Afferent is when the body is sending a signal to the message. Anyways, when the motor nerve is activated, that motor learning nervous system is activated to bypass that dysfunction. That's when we're seeing teeth getting sore, they're worn. Every time I look at someone's mouth, and this is what I'd like to encourage every dentist, every young dentist for that matter. It's harder to get the more mature and seasoned dentists to see things from a new paradigm, although I'm glad to say there are a lot more that are becoming airway conscious. But younger ones, they need to know you are in a crossroad where you have to come to a dead stop and decide which direction to go. TMJ is that. You're not going straight up. You have to stop at a stop sign, either make a left or make a right or go straight. You cannot bypass that or something will happen. And it may not be a good thing because at a four-way stop, you can't just go through it. 11 years ago, when I was a young dentist, I did the same thing because that's why we call it a practice, right, Howard? Because we learn as we go. I always wondered, when am I going to start doing this? I'm still practicing it. I would tell patients, you be patient while I practice for that reason, because the science wasn't there. When I came out of dental school, airway was another thing. The unfortunate part is, though, our education system is always 2 decades lagging behind what's out there as far as the literature and the technologies and science. And, you know, they come out of school with amount of student loans. The last thing you want to do is going through another advanced course like what I'm doing with Dr. Stewart or Spear Educations or Poise, learning something beyond the scope. And by the time you're coming to your senses that I don't know what and maybe that curiosity bulb never goes off, by the time you get to sit in here and say, I want to be a smarter version of myself, you're 10 years into practice. I wish I had known then what I know now, but a younger 25-year-old dentist, I would say, don't practice until at least you know more and learn how to look at the global issues of the head and neck. And don't look at the teeth as just an entity, because they're not. They're attached to the rest of the body. Goes to my title, I told you. The teeth will tell you the story.
So I'm sure you've been to many countries around the world. The United States is only 4.5% of the 8 billion people. It's only 330 million people out of 8,000 million people. Americans take half the prescription pills. So when you start saying something like this in America, I don't want to hear anything about the personal trainer stuff. I just want to take a pill. How do you change that mindset where, I'll give you an example, and some of it's crazy. I'm dealing with these two issues. I don't want to get too personal or she'll figure out, but my personal trainer, or one of them, she pulled her shoulder during tennis, and the doctor did a surgery on it and told her not to play tennis for, she couldn't use it for, I think, 8 weeks. And after 3 weeks, she started playing tennis again, tore it again. And he did the surgery on her again and told her, look, you cannot play tennis for 12 weeks. And if you do, I'm not going to see you again as a patient because you need a psychiatrist. She only made it 3 weeks, went and played again. I mean, so that shows that she was addicted to working out. And then I have another person that had a disease, kept having eczema and psoriasis and wanted pills, doctors, and always wanted to take a pill. And finally she went to a naturopath, and a naturopath said, quit using all these chemicals and soaps and conditioners. And if you would just quit showering and shaving and doing all your ritual stuff, your normal skin microbiome will grow back and you won't have all this eczema and psoriasis. And you know what? She's 33 years old and it finally worked. Everyone else wanted to give her a pill or another cream. And one doctor said,
music to my ear.
Another doctor said no.
I work with a lot of naturopath doctors, and they like hearing what I got to say. For that matter, Howard, I'm anti-medicine. That's my title. I've not written a prescription, 5 years. I don't like medicine. I think body is capable of healing itself if we give it a chance. And to that effect, I think the bigger problem is, going back to that 25-year-old doctor you mentioned, we're thinking of us as holistic, as if we have some voodoo science. But really, we're studying the body and the health and how to replicate health rather than disease. Like I said, I look at the effect of the disease on the body and knowing how I can get it back to health. That's the goal. And I think that should be the goal and number one goal in every doctor. But the problem is our doctors are bound to what insurance will provide, right? It's a reality. And what does insurance provide? They fix sickness. They don't prevent. How much preventatives, especially in dentistry, preventative is not something that they're hot about. And Medicare, for that matter, is more about fixing and treating disease as it's worse. So if you have a mild condition, they will not advise any treatment. And for that matter, some commercial policies, not all, they follow Medicare policy and fee schedule for that reason to give treatments, because they think, well, that should be the norm. I think that's the opposite. And I don't believe we're giving any care, access to care, better access to care by putting everyone on medicine. Because if that's the system to treat people as sickness, what we've done is just given them a bunch of medicine instead of promoting prevention. We're all waiting until people are sick, and then we treat their symptoms, and then even worse, piecemeal. I'm going to treat only the symptoms of the head and neck. So if you go into a chiropractors say, well, let's just put your cervical necks in the right place. And I've seen some horrendous practices from those that are not specialized in the cervical area. The NUCA doctors, Atlas orthogonists, are really specialized in treating C1 and C2, which in effect is completely correlated to the head forward position, which goes along with everything I talked about so far. So if the C1 and C2 are affected and you're only treating that, the culprit's still there. As I always say, the floors are wet. Depending on what kind of a person you get to mop your floors, they will mop your floors, but nobody closes this. Nobody asks the question, what's the culprit? Where is the leak? If you're not closing the leak, you go back to the chiropractor. Same thing with the dentist. I broke one tooth, you're going to break another. We didn't fix anything. We just silence the symptoms, give them medicine, and ADHD meds. I mean, when I heard the stats on this one, it blew my mind. And I have to say, there's got to be some kind of stock market, some pharma companies, bigger powers and lobbyists behind this. Otherwise, I mean, there's a lot of industry behind medicine. We all have to agree that it's a business.
And food.
And sick, that too. That food is making us more sick than all the processed food. Remember I said allergens and food that we're putting in our children's body is what's causing them dysfunction. What would have been ordinarily a normal route of breathing is basically halted as a result of the allergens and the food and practices and habits and things that we do. We don't have those problems in other parts of the world. Gluten is one. I mean, if you go into Europe, even if you have gluten allergy, and I've heard a lot of my friends, you mentioned being all over the world, in other parts of the world, gluten allergy is not a problem because they don't process the wheat the way we do. All this genetically modified food that now our body has to figure out how to process. And when the immune system is geared up towards something that doesn't resemble food, guess what? It goes and shifts it towards non-food and attacks it. This inflammatory processes in our bodies, in head and neck, and just all over. We're living in a constant state of inflammation, sympathetic system, and all these byproducts of fight or flight or freeze. And the cortisol is a big one. And when bodies are basically living in a state of inflammatory conditions, our amygdala is responding to that. Amygdala is not responsible for communications. It's where emotions get exchanged. And when you're constantly under attack from stress hormones and stress byproducts, the behavioral changes happens, lack of empathy and angry people, road rages in children, ADHD symptoms, autism. I had a conversation with a patient of mine who's a psychotherapist, and she said there's a lot of underdiagnosed autistic kids, but we also know there's only 5% of children that are truly autistic at best. Now, if I tell you the statistics of the number of kids, the percentage of kids from 3 to teenage up to 18 years that are on ADHD and autistic meds will blow your mind, close to 17% and growing. 5% diagnosed, 17% on meds. We're basically sedating our children in the state of inflammation and dysfunction. And as they go through life, they're breaking down. And I mean, I would remember when I was growing up, I grew up in Iran. When I grew up, young kids wouldn't go to chiropractors. I mean, that's where older people go, if that. That's not chiropractors and physical therapy. And those are not things for younger people. But almost every patient that I come to my practice, I screen them. I proactively ask them those questions. 9 out of 10 say yes. I constantly see a chiropractor. I constantly see someone for pain management. And yes, I am taking ADHD meds. And that's mind-boggling. That's pretty much why I concentrated on the things that I do. I know it's a grassroots movement for me to go against a system that otherwise is meant to treat disease. But I know there are really smart doctors out there. It's just not me, not only me, but there's a lot of them out there that are researching, asking the right questions instead of giving people just beautiful teeth and smart white straight teeth, which, by the way, won't last. It will relapse. If you're having problems with airway, those orthodontic cases relapse within a year and a half, if not sooner. I've seen many of them. These children are having a ton of airway issues, and those retainers are hanging on to dear life because wherever the braces or the clear brackets go, and the tongue and the lip is there, and they're not living correctly, they're not functioning correctly, so things go back to a square one, and they have to go through the third round of ortho, which is nothing but damage. Orthodontics are very invasive treatments on the teeth. Shortens the root, damages the enamel, plaque, decay, microflora changes, I mean, name it. So it's a very encompassing subject. Sometimes I catch myself going down that train sometimes with patients, guilty as charged. But as you can tell, it's not something that you could touch up on and leave it, because every can of worm you open regarding the body, you find the answer that this is not an isolated problem, and you cannot have a healthy body when you have all this disease concentrated in one area. I mean, every person's head and neck muscles that are tense, facial muscles that are tense, jaw joints that are making noise, teeth that are worn beyond their natural process of worn dentition at a young age. Those are not normal. Those are dysfunctions. Those are diseases, pathologies that we're silently basically treating with a bunch of porcelain. I hate to say it.
Well, you know, it's funny. You definitely respect the 3 rule of threes that really explains the nature of our body. We can only go 3 minutes without oxygen, 3 days without water, and 3 weeks without food. And the oxygen is everything. But I have to tell you, I'm so old. I'm 58. When I got out of dental school in '87, they never mentioned sleep one time.
Not even my age, and I'm not old. You're not old, by the way. It's a number.
I mean, it wasn't even a thing. So my question would be for you, how did I get out of dental school where they never even mentioned sleep, and now you can't go to the airport without seeing a book on it? What set this in motion?
You know, the thing is, the more I look at it, I think the diseases that we used to treat back in when you came out of dental school, or maybe 1960s to 1970s, things were different. The diseases that are progressing now are a lot more advanced in airway. Like I said, the cultural habits and things have changed tremendously. What happened in 1970s, 1960s? Moms start going to work. The babies did not have as much time with the mom. Processed foods was introduced to the market, packaged food, and the food industry picked up, which you touched up on. So our children and youngsters, and even kids, people my age, again, I did not grow up in US, but people that did, like that are my age, this generations, they did not have real food exposed to them. They did not have an environment that was giving their body a chance to grow their actual weight, defend itself, build an immunity. So that all changed, and it takes at least 2 or 3 decades for those effects to surface. When you came out of dental school, you had amalgams to replace, and correct amalgams or decay was an issue until fluoride came in. Now we got that under control, periodontal disease, and we came up with the solutions. The diseases are not the same anymore. We are training our doctors to treat diseases the way they did 40 years ago, while our diseases of this generation are 20 years ahead. And the doctors have 20 years of catching up to do. Now, how many of them would they spend thousands of dollars and hours of CE out of practice while they have $500,000 in loan to sit in a whole another course just to learn a holistic way? And I hate to say this is holistic, Howard, because when I hear the word holistic, to me, that means let's hold hand and sing kumbaya and energy is going to fix it. There might be some truth to that. I'm from Boulder, Colorado, so I hear a lot of oil pulling can fix periodontal disease. Maybe. However, I think if we can get the doctors to start on early and be more updated and start training our doctors early on towards the last year of dental school and putting them in the same classes. Let's say medical doctors that are in the verge of going into residencies before they do, and letting these doctors see how much from the same angle looking at the body. Don't think that your area of practice is only the mouth. No, that's what you specialize, but understand how it's related to the rest of the body. That should not be a privilege. It should be a norm for patients. That should be a norm for patients to go to a doctor and ask him about other conditions. So your symptoms are symptoms. Great. Let's just find out what else could it be. Look beyond the box. Know what's in your box, but look outside of that box, because what you think is a simple problem. I'll give you an example. I had a young 28-year-old girl that moved to Colorado. She had sleep issues that she did not know about, headaches, and she was seeing a chiropractor maybe a couple of times a year. She moved to Colorado up until I did an exam on her, and I said, I think you have some jaw noises that I'm hearing and tension in your jaws and worn front teeth. And I said, there may be a component into your airway. So next time she comes back, she said, I might have that problem, but now I'm having a lot more neck issues since I moved to Colorado. So she's started seeing chiropractor and physical therapist. And she would see me from time to time. And I was at the time trying to relax her jaw because she's intense amount of tensions in her head. So as I'm working on relaxing her jaw in the most natural position, the chiropractor she's seeing, they feel like they know everything, right? We all think we know everything. And goes in there and releases the one muscle, the lateral pterygoid, that basically is holding her jaw in a semi-quote or a status quo position and completely release that muscle. Now, this patient ended up with an open bite. She has more pain than she started with. She's completely dysfunctional. It's almost like all of our doctors are in a 10-lane highway. Think of it this way. We're driving with no rear mirrors, with no side mirrors. We're running into each other's lane, and patients are paying the dues for that. They're getting overtreated, undertreated. They're living with symptoms. We just don't have diagnosis. I mean, anyone can treat. I can teach anyone to treat. Not anyone. You can teach anyone to prep a crown, to put a night guard, clearly, as you mentioned, in someone's mouth. It takes a doctor to diagnose and find out. And if you're not taking that seriously, those titles after your name seriously, and you're not putting your best foot forward, that's where the disconnect is. And sometimes I think I'm the devil's advocate when I speak like that, but we're just focusing on what we know, and we just toss the patients to the next provider when we're thinking, you know what, this is outside of my scope. I think we should just have a conglomerate place where ENTs, dentists, orthodontists, chiropractors, physical therapists all can look at the patient, pour in their opinion, and have a triage. We should not be separately diagnosing them, because what you might think it's a TMJ pop, it could be an ankle issue. I've actually had patients go see their chiropractor or physical therapist and put an orthotic in their foot, and the foot was out of balance, and then it transferred all that imbalance through to the joint, and the jaw stopped popping. It's as complicated as human kinetic chain can get, and I guess I'm lucky enough to be working on the most complex part of it, and I cannot get enough. I tell you, Howard, I've not stopped learning since I started learning, and I don't know where my journey will end, but I'm appreciating the time that I get to come in and shed light, at least in in an opportunity like this, getting in front of some younger dentists and letting them know what's out there, what they don't know, and what would benefit them 40 years, 30 years from now, knowing what I know in dentistry in relation to the rest of the body.
Man, you said so much, but so when we're talking about the dental, the three rules of the dental rule of threes, says your patients can only live 3 minutes without oxygen. So you're saying learn TMD, occlusion, sleep apnea, storing, and appliance therapy. And when you talk about 3 days without water, you should be drinking water. We're the only animal on Earth. We're the only animal, plant, eukaryote, prokaryote, fungi, archaea that drinks anything other than water. So 3 days without water, just be like all the other animal kingdom, only drink water. But when you say 3 weeks without food, almost 80% of everything eaten on Earth is made from 10 companies: Nestle, PepsiCo, Coca-Cola, Unilever, Danone, General Mills, Kellogg's, Mars, Associated British Foods, and Mondelez. I mean, Nestle start out in chocolate. PepsiCo, Coca-Cola start out with sugar water. Unilever's a damn car company. I mean, my God. I mean, how do these kids have a chance when
they don't? That's the problem.
When you go to the store and 9 out of 10 things they're going to eat is going to be out of a package from those 10 companies. How do you fight that?
Absolutely. I mean, I look at this and I'm thinking, we did not have this problems 40 years ago. Why all of a sudden? I mean, to say that our nervous system or their hormone system, their chemicals are out of balance, what's that? So you know what? You want to know my rule of thumb? And it's really a rule of thumb, actually a rule of finger. Get a food, put your finger at the beginning of the ingredient list. What's not covered by your finger is not food. So if the list of ingredients is beyond what is covered in your finger, what you're about to put in your body is furniture. It's not food. It's not recognized as one. If something can last for days and months over shelf without expiration, You gotta ask, how's my body gonna take that, extrapolate the nutrition out of it, put it where it needs to go, and replenish itself? The answer is it can't. Your liver is going to be overworked. Our bodies are an immune system that is supposed to be doing a surveillance on everything, including cancer cells that are not normal, and they're going to try to come up with the way to destroy the rest of our body. It's basically what it is. Our immune system is bogged down by recognizing all this stuff that we're putting into it in the name of food. And yes, we are, we are 80% water. You mentioned it. And water is not combined with anything else. And our water pH is a whole another subject, just the way it is treated. And our pH is changing. That just changes the physiology. One of the biggest problems with airway issues, again, it keeps going back to airway, just trumps all, because airway, when you're mouth breathing and taking all this air through your mouth, you're dumping a lot of the CO2. The brain doesn't recognize the O2 level. The brain goes by the CO2 level. CO2 is what sets the pH in blood. When you're dumping all the CO2 out of the body, the pH is going to be lowered. And blood-brain barrier to activate diaphragm in oxygen desaturation doesn't go by how much oxygen you have on your hemoglobin. It's going to go by the CO2, because at the tissue level, it's the CO2 that sets the pH for oxygen to be released from hemoglobin, because it's not soluble in blood. And if you're dumping too much CO2, the blood cannot use that oxygen where it's most needed. And diaphragm activation is going to be affected, because the brain has to tell diaphragm, especially in deep stage of sleep, to activate the diaphragm to breathing. When that pH is not there, the physiology is not helping you breathe. That's why folks as young as 20 have to be on CPAP machines. And like I said, everything goes together, from your pH to water, the amount of water you're consuming, to the food you're consuming, to how much chemicals your body has to go through processing, the liver, kidneys. I mean, we're basically breaking down way faster and in a not so natural way than our bodies were designed to. We're making it to be older. We're keeping folks to live older, but they're not having quality of life. They're needing to pop 20 different pills for every condition, versus we could just focus on prevention and fix the problem when they're younger. And I'm saying young, even my age, your age. We're not looking at chronological age the way it should be looked at. I think we're breaking down way faster because of our lifestyles, because of our environment, the food, just about all of it. And to hear a dentist say that, right? I mean, the last thing I talk to my patients about, believe it or not, is their teeth. It only gets me enough to the door to talk to them about that they've worn their teeth. And after that, I'm not talking about their teeth. So, I was
you said you want
to
take that course. Dentaltown has put up 400 hour-long courses. They've been viewed over 1 million times.
Wow.
And we started that in 2004 because I never understood why if you're in Boulder, why do you need to get in a jet and fly all the way to Florida or California or New York to go learn something? I mean, like right now we're on video, and now the pandemic, the courses have skyrocketed. So I'm Howard at dentaltown.com. I do my this, but it's Howard Goldstein, so it's Hogo at Dentaltown. He does all the online CE and all the message board stuff. But by the way, a lot of times people will send me an email, Howard at dentaltown.com, and say, hey, I got kicked out of Dentaltown. Well, I can say two things. Number one, I'm Howard at dentaltown.com. I have nothing to do with the management of the website. That's Howard Goldstein. So he's Hogo at Dentaltown. And I can also tell you another thing about all social media, because Mark Zuckerberg, his dad's a dentist, right? And, he's been on the show 3 times. He called me the other day about something. But the bottom line is in the morning on Dentaltown, there's no typos. Everything's proper. Everything's great. By 10 o'clock at night, the typos start going, and, they're drinking. And by midnight, you're an idiot, So all I can say is, you're not supposed to drink and drive. Don't drink and post. That's all I'm going to say.
I got that.
Try to say.
And don't drink and drive either.
But it's tough because my 4 boys have turned into 6 grandchildren. In fact, I just turned 58 August 29th, and the day before my birthday, August 28th, I got my 6th grandchild.
Congratulations!
And her name's Evelyn, and she's so adorable. But it's going to be so tough for Evelyn because I mean, I mean, hopefully it'll get turned around, but I just saw this study where they nutritionists went into high schools. And the high schools, they didn't want to get rid of their Coke machines because they got big contracts with Coca-Cola. I mean, how disgusting is that? That all this tax money going to schools, but Nestle, PepsiCo, Coca-Cola, Unilever, Danone, General Mills, Kellogg's, Mars, Associated British Foods, and whatever the hell Mondelez is. I mean, those 10 companies make 90% of everything that you buy in the 60,000 SKUs at Walmart and what you eat. But they couldn't take them out because obviously America has nothing to do with freedom and liberty. It's money's the answer. What's the question? It's just a complete whorehouse. And anyway, the whorehouse school made a whorehouse contract. But the nutritionist said, well, let's just do this. Let's move the Coke machines on in a more inconvenient place and the bottled water up front. Just like when you walk in a grocery store, they know you're only there for two most likely things. You ran out of milk and bread. So you walk in the front door, milk is clear caddy corner in the back corner, and then bread you have to walk clear across the store, and then you come back, and then they put narrower lanes on the sides where the margins are low, like canned goods and stuff like that. And then where the margins are highest, they put 3-cart lanes in the frozen area because they want you to cut through the big wide frozen, because anything you grab in that frozen and throw in the basket is, hopefully a third margin. And so all they did is move the Coke and Pepsi whorehouse machines that your whorehouse government signed a contract with and to kill your kid. And they move the water closer, and kids drink 20% more water and 20% less soda just because of convenience. And in America, every single corner's got a 7-Eleven selling unlimited Coke, unlimited nicotine,
my gosh, don't even get me started
unlimited
with that.
caffeine. I got 6 grandkids, and if I just go put gas in the car, they run in there and they've got, they've grabbed soda and candy and cookies and this and that. And I'm just like, wow, man, it's going to be. And I try to tell them that, like when I take them to the zoo, the only thing Grandpa talks about at the zoo is that every other animal on earth only drinks one thing. They only drink one thing. They only drink water. Look at that elephant. You want to be big and strong? Look at that elephant. It's 4,000 pounds. It only drinks water. So the water thing is tough. All the food coming out of I'll never forget, I don't want to get into any politics or anything, but the president before, the one we have now, his wife was really into wanting to eat healthy. And when she came to Washington, she was going to cook a garden and go on this big deal about eating healthy. Oh my God, Big Foods had her silenced in a week. I mean, she talked about it all during the campaign and about the first month in the White House, and you can tell big money stepped in, and you never heard another word about her.
You drive the message home. That's exactly what I was touching up on. It's the companies behind it, the stock markets and the lobbyists. That's what's killing us, because we are basically in a system that's meant to generate money. At the end of the day, it's about what makes money. Growing food fast and getting it to consumers ready like that. I don't understand. I mean, when I was growing up in Iran, we did not have drive-through. Now the drive-through is a norm everywhere. And I got to have a childhood. I do remember we actually had to cook our food. And it wasn't something you could expect. Like my kids thinking that, let's just get into the car and go and drive through and get food. And I'm thinking, when I was a kid, the food has to be cooked 2 days ahead of time, prepped 2 days ahead of time. It was a 3-hour ordeal to be ready before you can consume it. Now you order it and the food is in your hand. That speed process, something will give. And the nutrition is not a part of it. I mean, looking at years and years back, all the other parts of the world, and I think it's leaking into other cultures, like I said. And the more we're seeing modern cultures coming around, the first thing that changes is the food, their habits, and their behavior changes, because they're associating themselves with this Western diet, is the it diet, and it's nothing was killing us. I mean, this is jet fuel we are putting into our bodies.
You know who it's killing the hardest? You know who it's killing the fast food export? I've been in Middle East, I've lectured in 50 countries. Kuwait, United Arab Emirates, Saudi, the Middle East ran off with fast food.
Mediterranean diet is probably one of the best diets for you. I mean, and from the texture to the nutrition to the level that is prepared, it's probably one of the best. And when I'm talking to patients about anti-inflammatory effects, CBD I touched up on, we want to reduce inflammation in the body. And if our food is not nourishing it, but adding to that, we're just going to get it out. Why are we, I mean, in America, if you're poor, you basically are eating junk. In other countries, I mean, at least when I grew up, when you're poor, you just don't eat. But you don't eat junk either because you have no access to additional junk. It's either organic food or it's no food. But unfortunately, we have access to food that is inexpensive, heavily processed, longer shelf lives. And again, I don't think this is a small, isolated problem. One can argue, how could you connect one thing to another? I can and I will, because I think we're living in a state of inflammation. We're living in a state of sympathetic activities and the breakdown of the whole system. And I hate to call it a disorder. I hate to call it a temporomandible joint problem. I hate to call it just a sleep apnea issue, because when we're looking at it, when we're getting a complex problem and breaking it down into little problems that we can solve, we lose the concept of the whole picture. But once we step back and see how this whole dysfunctional system, we're actually seeking leaky gut is connected to sleep apnea. And sleep apnea is related to jaw growth. I mean, leaky gut is a huge, huge subject right now. And food sensitivity. I mean, you can't be sensitive to 40 different food. You know, how is it our bodies are just basically, before processing food, it's just releasing it in our bloodstream and our bodies are just recognizing that as some foreign object. You know, list of food is getting smaller and smaller and smaller. And anti-food or foreign food or furniture, as I call it, is becoming bigger. We're putting one in our system.
You call it furniture?
It is furniture. When I look at a cookie, and I call, and people thinking, how is that, you know, what is the brain's part? Because as a trainer, one of the things I do with people is getting them to have a better relationship with food. And unfortunately, food has become more of a stress factor management. It's more of a drug than an actual nourishment and for replenishing and nourishing our system. It's fuel, it's for replenishment, it's not for palate pleasing, it's not for a mental condition, but it unfortunately becomes one.
So, you know, so you're saying it's furniture, not
fuel? It is
fuel?
Furniture. It's not, if it is loaded with the chemicals that you can't even spell, I might as well call it furniture. It is furniture. Decoration. It is not food. You should not put it into your body because.
Well, I want to ask you about this. It seems like, you know, the thing that's great about, you know, like say I'm almost 60, and you get to see most rodeos now for the second or third time, and I'm seeing like when I was in high school, if you got caught with a 12-pack of Coors beer and a fifth of Jack Daniels, the police officer would give you a lecture. But if you got caught with marijuana, you were handcuffed and you were taken to jail and you were beat up. You know, it was crazy. And now that's kind of even. When I was young, gay marriage. I mean, people would leave church to go to the park to beat up gay people. I saw that. I mean, I witnessed that, and now gay people have the right to be married. But the one thing that seems to be going the wrong way is a list of all these autoimmune disorders, arthritis, rheumatism, diabetes, MS, celiac sprue, lupus, inflammatory, and they're all expecting pharmaceutical to come out with a new pill. Hey, where's your pill? Where's your pill for this?
Added, which comes with 10 different side effects. One of them is death and mental disorder. What are we fixing by adding 10? The profile of side effects in some of these meds. I mean, have you ever seen the side effects of Adderall? I mean, you might as well just die. Like, these kids are taking it like it's candy. And yeah, it might just give them a little bit of a relief for focusing, but they're dying.
I actually lived through this where my, I had 4 boys and they were all born in 60 months. So the grammar school, the middle school, the high school was all on one street. They went through it. And the teachers begged for me to put half of them on these pills. And I'd say, well, what's wrong? And they go, well, he just wants to bounce around and and I'm like, okay, he's a 10-year-old boy and you want him to sit still in a chair for 10 hours a day? What freaking planet are you from? And then I would just look at it and I'd say, okay, so after 30 minutes of sitting in a chair, he wants to go run outside and play, and you want me to drug him up? I fought it. I just would not do it.
The better word is sedate them so that they're good little boys and girls in a cookie cutting system that wants to keep all of them mediocre and lined up and do what they're told. And you know what? Our kids are born with a talent. They're born to live, and they're not getting a chance. They're not growing. They're not getting nourishment. They're not breathing. They're not growing. This is why I'm here in this show with you. This is why I hung the drill and I'm doing what I'm doing, because there's a lot more to the story than one can meet. And all we're doing is scratching the surface. And, you know, going against a system that is, like I said, designed for treating disease, it takes a lot more for a group of doctors to say, you know what, I'm not going to fix anymore. I want to stop the disease so we have a generation coming that doesn't need to be fixed. What happens if we just stop taking insurance and stop working with Medicare and what would just pay to fix? Let's just find out what's wrong with the child that's just born and is not breastfeeding. Why is a child colicky and not sleeping through the night? Let's fix that, because that kid doesn't need another medication for acid reflux at 6 months old. They need to learn to use their esophagus correctly and not use their mouth for breathing and drinking. They need to breathe through their nose. And why are they not doing it? Because the minute they're born, we're sticking a pacifier in their mouth and mute them. Basically.
So I gotta tell you something I'm seeing in my backyard. So there's a lot of professional athletes down. We got the Arizona Cardinals, we got a hockey team, we got the Suns team, and their trainers are literally putting electrical tape. The white electrical tape over their mouth, because when they're out training, if they breathe through their nose, it gets nitric oxide into the bloodstream, which dilates the vessel, and they breathe through the mouth. And these kids are telling me that they made it all the way to the Arizona Cardinals, and no one ever told them. And now they're having to relearn breathing since they were a little kid. And it's so impossible that the only thing they have to do is put that over there, and they say it scares you at first, but then you start relaxing because you actually breathe easier. It's
a technique taught by Dr. Buteyko. It's a technique practiced for many, many years that we can actually resolve asthma, reduce symptoms, or cure it to some degree if we teach the kids to nasal breathe. Because you touched upon nitric acid, and nitric acid is a natural gas that pulls from paranasal sinuses into the air that we breathe. It sterilizes it, kill virus, if we really are up on the coronavirus, before it makes it to the lung. And it's a dilator, and it has a amount of other benefits for the body. And the only way you can take advantage of it is if you're nasal breathing, pulling air from the paranasal sinuses. And to the same effect, the mouth breathing, the fact is, like I said, adjusting the volume of the air that you're getting, because mouth breathing is way too much oxygen going in, way too much CO2 going out. That's direct effect. And the taping technique is actually a proven method that works. I practice that with many of my patients that are in appliances as we're trying to correct their habits, teaching them at a young age to not use their mouth for breathing. Mouth is only for eating. And when you're not eating, you should not have your mouth open.
You know who has the perfect nose? You know who has the most perfect nose? The dolphins. The dolphins. It moved back to their blowhole. Their blowhole is their nose. And they got it completely out of their face. It's not in their snout. That is their nose. Right on their blowhole is their nose. And every time I see a dolphin, I just think, it's probably better to separate the mouth and the nose like a dolphin. But hey, I can't believe we went well over an hour. If these people want to hear more, how do they get in contact with you? Do they go to PeakViewDentistry.com?
Absolutely.
Do they
that is
email
probably
you?
one of the best. I'm very active, Howard, on my social media, Instagram and Facebook at PeakView Dentistry. Almost every day, I make it my mission to go live and talk to people and give them information about everything I talked about the new treatments we do with Vivos, treating people holistically. And I love to hear more about other people that are interested about subject, because a lot of things that make sense to me and is norm, I get the questions that, wow, I had no idea. I love engaging, and that's the best way is through my Facebook. I love connecting. And our website at PeakViewDentistry.com. I'm very responsive to my emails as well, so that would be another good way to contact me.
So Facebook.com/PeakView Dentistry or PeakViewDentistry.com or Instagram PeakView Dentistry.
Correct.
All right, and there she is. My gosh. You're so adorable. You have the second prettiest nose behind a dolphin. First it's a dolphin, and then it's you. Seriously, Bahar.
I'll take a compliment in any packaging that it comes in. Thank you so much for inviting me to your show. This was amazing. And let me unload my passion. I really enjoyed it.
And I'm Howard at dentaltown.com. Email Hogo, Hogo at dentaltown.com. In fact, I'll shoot you both. I'll shoot you and him an email right now. And do those courses. And I'll tell you another reason I want to do that is you know what I don't like about my own podcast and media company going back about 10 years ago. When I was little, when I was in school, the senior class had one girl, and her nickname was Man Woman because you couldn't really tell if it was a man or a woman. It was like an amorphous thing. And my school, my class was the first class that started to have some. It was like 20 out of 120. But now those classes are half women. And I tell Dental Town every month, I said, I'm as the owner of Dental Town magazine, I can't put out an issue with 10 articles and 5 of them are old, white, fat, bald men. You know, there's half the class are women, and I love getting women role models on like you because I'm in these schools. They're more than half girls. They're like 55% women, and I know those 20-year-old girls want to listen to you. They're not some male grandpa like me. So thanks for being a role model for the young women who, I mean, look at all the Pierre Fichard. Is he a boy or a girl? G.V. Black, boy or a girl? I mean, the Hippocrates, father of medicine.
And you know what? I had great mentors for me to get here. Like I said, I have learned from the best of the industry. And at some point, you'd be thinking that, you know what? I want to leave my footprint and make my protocol in this world. And I want to get people to hear my message the way I want to convey it. So I've recently been named in the Woman in Medicine. I've been awarded the Top Doctor Award. And I spoke about this subject. And I wrote it down. And I thought, maybe being a little outspoken could sometimes backfire because, you know, a lot of things that I say have a bit of a political hint to it. But, you know, at the end of the day, I took an oath to be a doctor. And my oath is to do what's best for my patients, do no harm. And I know when you know what you know, you can't unknow it. And once your brain knows what you know, your eyes cannot stop seeing it. That's the reality.
Seriously, thanks for coming on the show. Thanks for being a role model. And thanks for what I love about you the most is that you didn't fall for big pharma, big insurance, and big food. And gosh darn, here's what I'm worried about the most. You know, my 4 boys are raised. They've flown the nest. I'm so glad I didn't kill any of them because they made 6 grandkids. And that's all I tell parents to do. You know, even though you should kill them right now, don't, because he'll make up for it.
There's ROI at the end of the day, right?
They'll make you a replacement that's even better. But here's, you know, if all the dental offices are bought by Wall Street, and then right now, you know, Cigna or what is it, CVS has bought Aetna, right? So now Aetna. And CVS owns Aetna. So CVS owns the doctors that write the prescriptions that CVS fills.
Oh
and so if all the dental offices are bought by Wall Street and then Delta comes along and buys them, then where does my granddaughter go when she needs a dentist?
Yep.
You know? And I don't want my granddaughter going to a dental office owned by Aetna and Delta and Wall Street saying, oh, well, she might have 3 crown opportunities when she walks in. Make sure to give her the crown pitch because she's got these little And it's like, no, I want my children to be able to go to the dentist. And the dentist ain't the pharmacy, it ain't Wall Street, and it ain't the insurance company.
You know,
it's someone
Howard,
just like you.
This is just like, you're just speaking my mind. And for me, I was a part of that corporate America dentistry, and I established a private practice with that mission alone. I don't want to be bound to what insurance tells me to do. I want to be a doctor. Unfortunately, the system is not meant for younger doctor to have that establishment and authority and moving that way. So we're a last man standing to some degree. I see that private practices are really trying to stand up and do what is in the best interest of the patients, as you mentioned. I don't care what your insurance pays. And by the way, it's not insurance, it's a gift card with an expiration and limitations of what you can buy, what, where. So whole nother story. But as you mentioned it, we need to survive this. I mean, I want to be that dental office that comes at the end of the day. I don't take any medical dental insurance. I do not care what they pay for. But what I could tell you, I'm really going to stand up for is what is in your best interest, how it can help you the least way. As Dr. Coyce put it, best dentistry is no dentistry. Bible.
Yeah,
best
but
he's doing dentistry.
Greek. Did you know that he's Greek? He fixes everything with Windex.
I did not know that about him. Now, thank you. I learned something about Dr. Coyce.
I love that about that Greek writing. But the bottom line is, if you want to work for the insurance company, go work for them. You want to work for Wall Street, go work for them. You want to work for the pharmacy, go work for them. But if you're going to be a dentist, be a dentist to your patient. And my guy, and on behalf of
reasons, right?
On behalf of my father, who died this day today, 21 years ago, he would, how he would refer to you and me. You know how whenever you have those independent thoughts, you know what he'd always say? He'd always smile and go, "That's going to be a hard dog to keep on the porch." So you are a hard dog.
I'm a disruptor through and through.
You're a hard dog to keep on the porch. Dr. Bahar Esmaili DDS, Boulder, Colorado. Thank you so much for coming on the show.
Thank you.
All
Thank you, Howard.
Have a great day.
You too.